Hey everyone, so it's Dr. Connie. Today I want to talk a little bit about PCOS. So it's Polycystic Ovarian Syndrome. So what is it? Well, PCOS is, like I said, Polycystic Ovarian Syndrome, which is a condition that affects 1 in 10 women of childbearing age. And that's essentially 10% of all women. And it's also the most common cause of infertility. And the cause of PCOS is really unknown. They used to think it was caused by an imbalance of really the sex hormones, which include estrogen, progesterone, and your testosterone. But they're finding that it's more like diabetes of your ovaries. This means that it's more of a metabolic dysfunction causing insulin resistance, which is a condition where your cells stop responding to the effects of insulin. It's much like type 2 diabetes, which responds very well to lifestyle changes. So the problem is that the test results can be variable based on timing of your monthly cycle, your weight, and your age, etc. So what are some of the symptoms of PCOS? Well, symptoms of PCOS can be drastically different among different individuals, but can include the following: infertility, irregular periods, sometimes acne, weight fluctuations, unwanted hair in the face and your armpits or even in your legs, thinning or losing of your hair, darkening of the skin in the armpits, back of the neck, or in your groin areas, anxiety, depression, and eating disorders. So how do you know if you have PCOS? Well, PCOS can be a serious life-altering condition for many women. It can lead to heart disease, infertility, diabetes, and even stroke. Although obesity is common among women with PCOS, not every woman with PCOS is overweight. A thin woman can also have PCOS. So how do you treat PCOS? Well, as I mentioned, PCOS is largely a metabolic disorder, meaning that we can reverse it with simple lifestyle changes. It's important to remember that PCOS is in large part due to inflammation in our body. We want to promote an anti-inflammatory lifestyle to nip PCOS in the bud. And because rigorous exercise can increase inflammation, it's advised to choose something low grade, something like Pilates or yoga-based mindful exercises to promote a healthy movement. So let's talk a little bit about our Alkaline Method approach to PCOS. One is to eat a diet low in glycemic index. So fruits can be high in sugar, so opt for vegetables instead. Number 2 is to eat organic, especially with animal products, as conventionally raised animals tend to have toxic hormone levels, which can drive inflammation in your body. 3 is to consider our signature alkaline detox protocol to drastically improve your metabolic pathway and improve insulin sensitivity in your cells. Number 4 is weight loss, which will help because it will improve that insulin sensitivity in your cells. Number 5 is to eat foods high in fiber, meaning lots of vegetables. 6 is to eat foods high in phytonutrients, which means eat a rainbow of colors for a wide variety of phytonutrients. Number 7 is to exercise intermittent fasting for up to 15 hours a day. Number 8 is to follow our elimination diet to reduce toxic burden and decrease inflammation. Number 9 is to take inositol to improve insulin sensitivity. It works much like metformin for diabetes. Number 10 is to take lipoic acid up to 400 milligrams a day, and that'll improve that insulin sensitivity. Number 11 is to add cinnamon to your cooking. It also aids in that receptor sites for your cells for insulin sensitivity. Number 12 is to add vitamin D3. Get your levels tested and take between 2,000 to 10,000 IUs depending on your levels. So I would get that checked. Number 13 is take time for self-care. Number 14, make an effort to get at least 8 hours of quality sleep. 15 is to practice meditation. 16 is do a digital detox. 17 is to control stress. And 18, Make sure to have a daily bowel movement. And if you're not having a bowel movement, make sure to take extra fiber up to 30 grams per day, along with a good quality probiotic. I'm seeing PCOS more commonly in younger women, with infertility being the biggest issue, along with physical deformities like acne, facial hair, hair thinning, and of course weight gain, which can be a detrimental thing for women if left untreated. At the root, it's an inflammatory metabolic disorder that can be treated with, like I said, simple lifestyle changes. So if you need help, call us for a consult. And also, if you like this blog, subscribe to our YouTube channel, Dr. Connie Jian, and also like our Facebook page, Alkaline Wellness, and of course our Instagram at Alkaline Wellness. Talk to you